All right. Well, thanks, Catherine, and hopefully everybody enjoyed getting to network and meet with some folks there. But again, we're super excited to have the folks from Health Design over at Emory come speak with us today, Dr. Monique Smith and Dr. David Wright. So welcome. Thank you for joining us. So I think for the outline today, we'll first just talk a little about their background and how they got involved in healthcare and innovation and being physicians as well. Then we'll probably spend the bulk of the time talking about health design. And so what's the concept and how it works and some of how they vet through ideas and some of the lessons learned there. And then we'll wrap up with just some future predictions of, where's healthcare going and opportunities in healthcare there. So we'll jump into that in a minute. Last, just housekeeping thing on this as well. As you have questions as we go, feel free to put them in the chat, and then Catherine will ask them to the group at the end. So awesome. Well, maybe let's just to get us started. Let's talk a little about just, how did you decide to even get into the crazy healthcare world? We'll start with, Monique, start with us first, and then we'll go to Dr. Wright next.
Sure. It probably started a long time ago when someone took a vested interest in me as a teenager and really wanted to expose into what healthcare looked like. I had, a grandmother who had been a nurse. My family's from Jamaica. I practiced as a nurse for probably over 2 decades and had a step back for her family. But outside of that, I really didn't know a ton about healthcare, and someone kind of inviting me in to understand what the space was and how people interact with people and how people can care for people in different ways was my entry point. But from that, I actually had a pretty winding path. When I landed in college, I was very much interested in social issues. Anthropology was my calling. My parents were devastated, but luckily I was still pre-med. Maybe I'd still make it and be a successful person, particularly for my immigrant family who wanted me to have a nice professional career where I could get a job at the end of the day. Thanks, David, for giving me a job. And it was actually in that anthropology path that I really learned what I'm really passionate about. And that's the piece of the intersection of systems and people and how all those things work together. And so my journey is probably much more defined by that anthropology lens and that true healthcare lens and how I landed there.
Awesome. Dr. Wright?
Yes, so mine's a little more, well, it's fairly classic, probably, as you will hear from many medical students and physicians, is that, well, no one in my family was in healthcare at the time. But what's most memorable is that my mother had her second case of breast cancer when I was 7 years old, and I remember it. I remember it very distinctly because she had to go to the hospital for her surgery on my birthday. So neither her nor my father were there on my 7th birthday. And I remember every gift that I got on that day. I don't remember what I got last year, but I remember every gift I got on that day. So that was pretty impactful for me because I didn't know whether she was going to come home. And so from that point forward, I was pissed off, frankly, at this thing that adults were calling cancer. I didn't know what it was, and I was just mad at it. Now, I didn't end up going into cancer research. I ended up going into neuroscience and neurotrauma, but anyway, it sparked my original interest, and that sort of led me down this path. So that's how I got into it, and I've not swayed since.
Very cool. I think it's one of the neat things about healthcare too, is just some of the origin stories of there's often an event or a specific relationship that draws people into healthcare. I think which is fascinating. So both of you, being physicians, tell me a little bit more about how you decided. You mentioned the neuro is your path. How you decided which path to go to, and then as we transition to health design, just more broadly, what made you want to get into the innovation side of things versus just practicing, in the emergency room or the operating room or in a clinic?
I'll go ahead since my mic's off or on rather. And I'm actually I'm going to skip the boring part about how I ended up in neuro. But I have a whole lecture around that if somebody wants to, share a beer, and we can do that. Yeah, so what about innovation? Well, it is kind of interesting. I was going to tell you, AT, that early, when I was born in the early 1960s, I'm telling a lot of these young folks how old I am. My announcement was that I was going to be an astronaut. and it said, "Welcome, new astronaut into the world." Of course, that was the exciting time of going to space and all those kinds of things. But something about that was prophetic, because it really, I have always wanted to be an astronaut. I never went down that path because I was going down medicine, but I have always been intrigued by innovation and building new things. From a healthcare standpoint, and once I got into healthcare, sort of continuing that interest, the bottom line is, and I said this to the breakout group, is healthcare is so broken. This is an area that is ripe for entrepreneurs, that is ripe for people who want to solve problems, because trust me, there are no shortage of problems to solve. And, there's no industry, in my opinion, there's no industry that's more critical, plays a more critical role to preventing human suffering in the world and providing hope than healthcare. And so if you want to be in a meaningful business, this is the business to be in. And I'll say, also that there's no industry that's further behind in basic technological infrastructure or more fragmented than any other sector that you can come up with. Come on, UPS beats us hands down in efficiency and everything. And we're just moving packages, and we're talking about people's lives. And so to work in healthcare and deal with all of this fragmentation is incredibly frustrating. It's couched in a term called moral distress, because we know how to take care of patients. We just don't have the appropriate tools to do it, or something continues to get in the way, whether it be regulatory or whether it be, just a hole in our system, whether it be data, you name it. And I'll stop there because I'll bleed too much into Monique, who's much more articulate than I.
Never true, David. But, again, part of this was my winding path. Like, healthcare was my way of understanding the world. So after, finishing up with college, I really wanted to be a global health, professional. I went out into the world. I went to Jamaica, which is where my family is from, and kind of started to understand how ministries of health work and large healthcare systems work. And from there, really kind of started to expand across the globe and thinking about things like, supply chains versus like your classic vertical diseases and how all those things interacted together. And at the edge of that, I was always interested in technology and data. So when I eventually kind of landed on my feet back in the States, I realized there was this burgeoning digital health movement that I'd somehow missed over a decade while I'd been kind of focused on the more global aspects of things. And it looked a lot like what I'd seen globally in different healthcare systems with different levels of resourcing. And I thought there was a lot of value that as a physician within a healthcare system could be offered. Because one of the largest gaps that I'd managed to see kind of around me was that we have lots of point solutions, we have lots of really great innovations that fundamentally aren't impacting the end users, right? This element of design that's not intentionally made. And so the ability to kind of work in that middle ground and be able to allow that whole pipeline to exist and to exist formally for patients, right? Formally for the physicians who practice it and the providers and the rest of the ecosystem. And, as what your mission is, it's fundamentally aligned in that I was someone who grew up in Atlanta. I saw the beauty of what we built here from an ecosystem perspective. When you think about where Emory sits next to the CDC, Georgia Tech across the way, when you think about the Carter Center, when you think about all the burgeoning big tech that's happening here, it's fundamentally obvious, particularly all those large corporations we have down the street as well, that we have everything in this ecosystem to be where healthcare happens, and we need players who sit in these spaces in between to help us weave it together. And that's fundamentally the vision of health design. We come at it from a perspective of acute care, of how do we make acute care effortless, how do we bring equity to well-being, but it's really kind of being a player that addresses some of those pain points within our ecosystem that has all the tools to do it.
Awesome. Maybe let's jump to that a little bit. Monique, just on the health design, tell us a little, you mentioned, acute care, maybe a little bit more about, what the goals and objectives are, and maybe a little bit of the founding story of how did this get started and why?
Sure. I'm sure David has a little bit of a different memory than I do. He at the time had been in Atlanta for decades at that point. And when I first started imagining health design, I was actually living in San Francisco. I had probably a pretty unenchanting experience with the last healthcare startup that I'd worked with, and really had a thought of, well, what am I doing in this space? How is this actually creating impact? And I literally sat down and kind of sketched out my own pitch of what it is that I wanted to be working on next. And that piece is really kind of thinking through, again, how we bring part of what's happening in innovation into these siloed spaces, one of them being healthcare systems, right? And I was fortunate to meet David along my path of kind of, interviewing for what was next. And he had a very similar vision of how we might be able to do that. And so Health Design essentially is, again, sitting across the entire acute care spectrum from the first moment you have a symptom, whether it's your toe pain, your chest pain, your back pain, and helping think through how you move through the system and how we as acute care providers in a brick and mortar and a virtual world are better able to enable that so that it is really the right time, the right place for you and wherever you are, right? I'm kind of thinking through that as a main part of our mission, but also fundamentally understanding that as a healthcare provider in a large healthcare system that has a great diversity of patients, a lot of the technologies that we see in our pipeline are not really made for that diversity of patients, right? When you think to the fact that about 7 out of 10 Americans aren't represented in the technologies that are made for healthcare, that's 70% of the market, right? So that's a massive issue that we have to address as well. So if we're really going to reach that goal of equity and well-being, it has to come much further up the chain when we're thinking about it potentially in design and how we actually then roll out technology-enabled care, not getting rid of the care, not getting rid of the tech, but bringing those pieces together for the actual provision and outcomes of care for patients.
Awesome. Dr. Wright, anything you wanted to add on sort of the origin story of how you all decided to more formally, put this together and build the organization?
Yeah, sure. I mean, as Monique said, she comes at a little bit different perspective, which is what's so great about this. As the chair of emergency medicine at probably what is arguably one of the largest programs in the country, one of the largest emergency medicine programs, and some of you out there may not know what emergency medicine is all about, but it's really for those acute unscheduled events that occur related to healthcare. And in being able to interface, know when to go to the healthcare system, know which area to go to, be able to get to it quickly or have it come to you is what the consumer is now beginning to demand. And to work through that seamlessly and then end up on the other side of it in a better place with a plan, with a wellness plan, with the ability to sort of improve your health, it just seemed like logical, right? So that was something that we sort of always says, why can't we do this better? Why do patients always end up in the emergency department? Some of them don't really need to be there. Some of them really do, and many of them don't understand the difference. How can we sort of help empower individuals, empower people in the community to know what to do whenever they have that chest pain and they're sitting on the couch? Should they call 911? Should they go to the urgent care? Should EMS come? Those are tough questions, and those are calls that I get almost every weekend. Is something happened to Johnny? Should I take him to the ER? And we just thought that, the technology has now come to the point where this problem is solvable. And we just need to stitch it together and weave this seamless system from that acute event, again, back into your home where you can live healthier. So that just seemed like a logical thing to do in the position we're in an emergency medicine. We're also always trying to think about not where healthcare is, but where it is going. And more importantly, where can we drive it, right? Sort of the Wayne Gretzky model of healthcare is, not playing where we are now, but where we need to be. And we're in the perfect place to help make those decisions in a healthcare system that's very mature and highly respected, and also in Atlanta, where we have the potential for all these partners and technology to help us create something that's just totally different than what we're so used to in the past. It just sort of grew up by just like amoeba, by exposure to external forces. And now it's time to kind of stop and say, okay, let's design it the way it needs to be designed. And that was the brilliance of Monique's health design, or health. It's health designed with an ED at the end. That's a capital. So Health Design ED. But that's sort of the components and how we kind of got to where we are now.
Awesome. Well, maybe be helpful to talk us through a little bit. What is that process for saying, hey, this is a problem we want to go solve, or this is an idea or some tech we think we have, or this is a company that may be solving something we could fit in. Talk us through a little bit of what is that process for evaluating something that you want to go after and pursue and try and use to change it to this is where the market is going.
Well, I'll let my design thinking person give that answer.
Awesome. At AT, I promised you there'd be a brand fight about how we say health design. There it was. So I mean, I think you have to remember we started in December of 2019. None of this Zoom was happening. So our vision of what we were going to tackle, as well as how we were going to tackle the process we were going to attach to that, has drastically morphed over the last, now 2+ years, right? So originally, we had a very clear vision of how we were going to work in the acute care space, and thinking about that continuum as in our classic terms of there are things that happen before you get to the hospital, there are things that happen when you get to the hospital, and there are things that should happen that definitely don't happen once you leave the hospital. And really kind of aligning that across what we thought was the intersection of value, and that value being that the cost of individuals as patients should be lower, but the quality should be optimal, right? And making sure that access really felt seamless as opposed to this heavy burden and all of this friction that we see in our system. And COVID kind of allowed us to tackle that in a really specific way, but not in the more general acute care lens that we wanted to, right? I see Justin Strager on the phone, who is one of the co-founders of Vital. If you guys don't know what Vital ER is doing, you should definitely check it out. They are definitely pioneering technology in the space of not just acute care, but in medicine that is changing how patients experience care, how, providers and systems actually provide care. And one of the things that they did very early on was partner with our system, right? And partnering with our group to really kind of think through a symptom checker, right? And kind of think through how, from a COVID perspective, in that one specific lane, are you able to kind of sort, well, what am I supposed to be doing? There's this new confusing thing going on with me. Should I be in a hospital? Should I be at home? How should I think about these symptoms? How do I actually sift through all of this information that is the technological age, but also is healthcare? That's not that different from what we think about when we think about a digital front door. That's not that different when we think about how do we help people navigate through a healthcare system, right? And when we think about as well, the ability to communicate with people in an omni-channel approach, right? The ability to kind of, again, proactively provide information to folks. We thought about this again from a COVID perspective of prevention, testing, vaccination, and then wraparound services. Those are the sorts of things that we should be doing from an acute care perspective, not just from a COVID perspective. So now as we're kind of opening back up into the space of not just pure emergencies and pure scarcities on the current phase of the pandemic that we're in, we're in a position to kind of really think through, well, what are the sorts of technologies that make sense across that entire acute care journey? And so for us, we're still thinking about that journey in the ways that I spoke about. And we think we're wise enough to have learned now that it's about co-development partners, right? It's not about building it in-house. It's not about kind of figuring out how we hire engineers and scale up and spin things out. It's actually figuring out what our sweet spot is as essentially an entity positioned within a healthcare system. In the chat, I saw someone ask if we provide care. Yes, if you want care today at 5 p.m., find me at Grady. Yes, absolutely. I hope that you won't need care there, but we're part of the healthcare system, right? So our department staffs over 5 emergency departments. David, you can correct me on that if I'm wrong. And they're across the Metro Atlanta system. And in that, we have and will always be providers of care. And what this vision is about how we innovate along that path and really kind of allow technology to enable better models of care. And so again, we still fundamentally stick to those visions and value of, again, what is it that we're doing for patients that drives down their costs? What are we doing for patients that really increases their ability to access care in a way that's optimal for them, but also that provides the highest quality of care? And then how do we do that with partners who are deeply invested in a co-development process that is iterative, that really kind of learns from the experiences that we see as we actually provide that care, whether it's from the patient side or the provider side.
Awesome. I want to go deeper into what you just said there about the co-development partners that you don't have a team of engineers building yourselves, but you find partners to co-develop with, and it's an iterative process, which I love. Talk us through how that works. From we see a problem or a part of that, either the quality or the cost side that you want to improve, then you go research or find potential development partners and you vet them in some way, and then you may pilot or trial something and it works and you go forward, or it doesn't and you pivot it. Talk us through a little bit of that sort of iterative process of finding the partners and figuring out, do they have something that could solve a need?
I see David nodding his head, but I'm happy to jump in.
Oh, no, this is all you, Monique. You've been
Great.
weaving this together for us. So yeah, this is in your court.
Great, perfect. So, I think part of this is the way that we always weave things together. You start with what you know, right? So, I mean, our pipeline has often been essentially the referrals that we get from people. Hey, someone's building this, you should check it out. And early on, that was way too broad, to be frank. There are things that should happen in the healthcare system. There's solutions that can fundamentally change the way that women after, and not just women, but people of all genders can experience after a sexual assault, right? There are technologies that can fundamentally change how we think about what's coming down the pipeline from a research perspective and make that more equitable. But what is our true ability to actually move the meter with a technology? Where do we actually have not only kind of vested interests, but also the alignment of kind of what we're doing from a service line perspective? So, I mean, that's probably the first piece of how we kind of thought through that. And then the pipeline piece happens again, formally and informally, kind of through the sorts of technologies that people have essentially said, hey, you should check this out. Then also from our formal landscape research, fundamentally, we're always looking for things that are best in class, right? That's always a puck that's changing. What's best in class today probably shouldn't be best in class tomorrow if we actually have a market that's working efficiently, right? So then how do we actually kind of think through how we figure out who's going to where the next place is, as opposed to what is the shiny object right now? There's not as much scientific method in that approach, but it's the honest truth of what's happening behind the doors.
And I'll add, when I was speaking before about putting this all together, it is really about weaving or stitching together those best in practices to create the solution that we need. Front-facing people will see one product, but in the back end, it's made up of very clever innovations from the community. Frankly, from the U.S. or international, whatever. But often as in innovation, people create widgets and look for a solution. We have problems, and we're looking for the right solutions to those problems. And so we have a little bit of insider knowledge as to know, okay, what are we looking for? Because here's where our problem, and sometimes we're actually surprised. Some people bring us some solutions and we didn't really know that, oh, wow, we really do have a problem there. We had sort of overlooked that. But that's the whole thing, is sort of who can sort of solve that front end piece for us. And it's still sort of divided in sort of the access piece, knowing where to go and where to get care, the actual care piece, where that's delivered and how that's delivered. And then that sort of after you've had care, making sure you stay out and stay healthy. They're still loosely divided into that, but finding the technologies that help us take a person through that so they just have the best experience possible and come out on the other end. And it's seamless, and they don't really even know that it was this company A, company B, company C that were providing the individual innovation. So that's Monique and her team have been working, doing due diligence on a lot of these different companies, and we're also wanting to stay flexible to the point that if a particular company is not going in the right direction or is no longer solving the problem, moving on to a different one. So that's always an option.
Yeah, maybe talk through that a little bit of, as let's say you have a problem, which I love, starting from the problem. We're big fans of that, when building businesses, is start from a problem and then you can find the right solution. But it's too often people start with the solution that's some cool tech, but it doesn't have a problem directly to go for. So I love that you said that. But tell me through that of, you got the problem, you think you've got a partner to do something, you bring them on. What do you look for that sort of makes you say, yes, they're hitting the milestones or execution, we want to take this forward? Or to your point, for whatever reason, this just isn't working out, it's time to move back to a different problem or a different way of looking at it?
Yeah, I'll give you a really clear one. So, I mean, after you leave that emergency department, often you get some papers, they're scattered on the ground, you go off into the universe, and there's nothing else that happens after that. But that's been in a moment of acute crisis for anyone, right? Anyone who comes in is always at a point where they're most likely to change, where they're most likely to address what happens next. I think there's a lot going on in this patient engagement space, but most of it has to do with appointment reminders. It has to do with, can you complete the screening form or do whatever else before you come in to see me, so you can actually make my life easier administratively, right? But thinking about that from the patient perspective, one of the areas that we are, care a lot about is how do we actually create those behavioral nudges that we as physicians are unable to do once people leave, right? Like I probably have a sliver of a window, about 10 seconds more to tell you, take care of your diabetes, stop smoking, make sure you get your follow-up visits. But what is the real opportunity in that space to communicate with people, to have that behavioral nudge? One of the partners that we've worked with for the last 2 years in On Health, previously known as Access Mobile, has been in this game of how do you actually create those sorts of messages that are effective as communication, but also create outcomes. And it's something that they've done globally, but brought to the US side of the market in the last 2 or 3 years, right? And in so doing, it's also the opportunity for us as physicians to kind of rethink how we actually get people to the sorts of services that you're never going to find in an emergency department, right? So how do we connect those dots in a new and different way? Part of what was fundamental in kind of figuring out that sort of match of who's an appropriate partner for that lane is one, a partner who was really able to address a really diverse population. The way that you communicate with me versus AT versus David to actually get us to the next thing that we want you to do, that's in the best interest of your well-being, is fundamentally different, right? And you have to think about those pieces of behavioral communication and the channels that you use to access them. And also being a group that was very facile in kind of the omni-channel approach, right? And then in addition to that, really having a track record that showed that there's something that they could do with scale. And I think one of the things that's often missed when folks try to work with healthcare systems is the sort of scale that we're looking for, right? Always happy to kind of help think through how you build and how you get to pilot phase. But if we're really thinking about rolling this across an entire patient population that is really quite diverse, you have to think about how that scales and if that scales well. And so that being as well a metric that's also fundamentally important. And behind that, there lives a lot of pieces around the details in the tech, the details in the team, the details in the ability to really partner in a way that's meaningful and come to a vision and iterate back and forth. But it's something that has to be part of the conversation so that that you're continuing to move in the right direction together. David, I don't know if you have anything to add there.
Yeah, no, I mean, we obviously have certain values, AT, that where was integrity in the company, that we have a vision that aligns with that company, with the company that we're working with, and how well we work together. I mean, how well we'll sit down at the table. I mean, Monique's had multiple conversations with the leadership of the companies that we are sort of stitching together here. And it's, their willingness to play ball, their willingness to sort of sit down and co-develop where co-development makes sense, or, provide us with I'm not sure if adequate's the right word, Monique, but, a deal that we can work with, right? Because at the end of the day, we provide value to the consumer. So, if working with your company is going to cost the system too much money, because we're stitching multiple different small partners together, at the end of the day, it still has to be a better value for the patient. So those are all things that we have to put into consideration when we work with companies. But for us, it truly is. I mean, this Health DesignED is really right now where we live, is truly about stitching partners together who are providing solutions to the problems that we have. And so that's why it's great to talk to this community.
Awesome. One last question on this, then we'll move on sort of the some future of healthcare. But what are some any lessons learned that we haven't talked about yet of doing this for a couple of years now and beyond, things that have made something successful or things that have derailed something? Any lessons learned for some of the entrepreneurs or folks here from your experiences?
I mean, I think they're the classic lessons that every entrepreneur learns. The willingness to pivot, right? The willingness to see what is the opportunity in front of you and understand how that vision might need to shift, either because the opportunity is shifting or the people who you're ultimately hoping to impact should also shift. I think the other thing that's certainly become more clear as well is that piece around how we actually think through our partners' kind of commitment to actually the impact side of things, right? We're healthcare providers, we're bleeding hearts, right? So for us, it matters what the outcomes are, which is a very different metric than what you typically see in an industry that's very much driven by venture dollars, right? And so how do you actually blend those things so incentives are aligned and you're actually moving towards something that, yes, has market value, but also has value to patients?
Oh, great stuff there. And I love that willingness to pivot that, very few of the overnight success story companies, you dig in and they pivoted multiple times through figuring that early thing out. But when they were starting from the problem, like you were saying earlier, David, right, that allows you the time to find the right solution because your problem you're solving is so important. Well, cool. Well, one more question or two, and then we'll open up some in the chat. But one last question or two. As we look forward in healthcare, what are some of the things that you see on the horizon that over the next 5 to 10 years are going to be opportunities for innovation in healthcare or a different way of looking at things?
I'll start. This is the easy one. It's in everybody's face every day, and that's AI, and that's information. And it's just the exponential amounts of information that we have to deal with in healthcare is unbelievable. There's no way an individual provider or providers can keep up with all of that. So, artificial intelligence, natural language processing, all of those techniques are going to be needed to provide a dashboard of data and information that we can use for decision support, but also just to, make sure that we're doing the cutting edge stuff. That is, we used to read it all out of a book and we thought we knew it all, and it's no longer that way anymore. And so we're having to pivot. Actually, the School of Medicine is currently pivoting on how it trains physicians. It's looking for a transformation officer. So if you know anybody out there who has actually some education experience, who wants to be the senior associate dean for healthcare transformation and education for the School of Medicine, that's what we're currently interviewing for that position, which is really kind of a cool thing. Because we really want our students to come out and be thinking differently about being problem solvers. And in that problem solving, how do they get the information to solve those problems quickly? And being able to do that, which is a bit different from the way the classic medical student has been trained in the past. So it's a new world out there. It's a ever evolving world. So we have to continue to evolve with it. And that would be the biggest one that I would say. And then I'll let Monique comment.
Yeah, I think that we've tackled a lot of the low-hanging fruit, particularly from a digital health perspective, right? And that's how we've ended up with a lot of widgets and a lot less innovation. When you think about actually moving the mark on what's happening in healthcare, you really have to think about the people who need to access the system the most and who have the highest levels of need. And if you can solve for that population, then you're really solving our fundamental healthcare challenges and also solving for the people who buy healthcare, right? And so when you think about that, that's a totally different perspective than the one that we've traditionally been using and selling, frankly, to the folks who are buying the widgets, right? The American Medical Association just this Monday launched their In Full Health, which I put in the chat, campaign, which is actually more than a campaign, but it's a commitment that they're looking for, a commitment for all the folks in the ecosystem to really kind of think through how do we center equity in the work that we're doing. And that means that whether you're able-bodied, whether you're Black, brown, yellow, or green, whether you speak English or don't speak English in this country, whether you are old or young, no matter what, you have an opportunity to actually access your full level of health and well-being. And, in order to do that, we as ecosystem partners have to think about things differently. What are we investing in from an ecosystem perspective? What are solution developers building? What are consumers actually consuming from a healthcare perspective? And I think they do a really great job of outlining there how we actually start to get to the 7% of Americans who aren't being accounted for in our healthcare systems and our healthcare technology. David and I grew up in an age, and I was not born in the 60s, I was born in the 80s, certainly decades apart. And, we both learned that the way that we dose medicine is on a 70-kilogram white male. And that's also the same way that we build technology. So if we're actually going to build for healthcare in a world that's changing, a world that, by 2040, we're going to be predominantly people of color in this nation. That's $3 trillion of buying power today. We actually have to start building for a much more diverse consumer, much more diverse set of patients who are actively using healthcare now. And I think that's where the trends in the bucket should go. And beyond that, also in the way in which we think about the way things actually come together. If you think about the mergers and acquisitions that have happened in the last year or two, the stacks have formed, you really kind of see a very different landscape of healthcare where we're moving away from this diverging element of really thinking through, well, you do this over here, you do that over here, and of course we're going to have great outcomes that are totally different than before. Instead, we're realizing that those pieces have to be connected. And actually, your tagline should not be, we can replace the healthcare system. It's actually, how do we actually work with all of the chess pieces on the board to make sure that they're functionally optimally? And so, I think there's so much room in this space to innovate, but it really requires a different mindset than the one that we've had in the last decade, and probably the true first decade of digital health in this country.
I love that. Two great areas. So any entrepreneurs listening out there, around just AI and information and how to bring that, together is a different way of practicing medicine. And then Monique, you're saying the changing demographics and diversity and the opportunities to build towards where the market is going. So love both of those. We got a couple minutes left. Catherine, we may have time for one or two questions, and I want to wrap up with some upcoming dates as well. So Catherine, any one or two questions you want to chat?
Great question from Mike at Copient around how do you address the issue of funding healthcare solutions? Often innovation with patient benefit are, it's hard to balance what pays the bills. So how do you guys think about that?
Well, we're physicians first, so we always think about it from a healthcare outcome standpoint. And if it doesn't meet that metric, I don't care whether it makes money or not. And so it has to meet that metric first. We're hoping Atlanta Ventures can help us with the funding. No, I don't mean personally, but I mean, having a community like this that can attract venture capital, that can attract angel funding, that can attract, sources to help all of, the companies that are sort of struggling or starting off, that have great ideas, and we don't want those to die on the vine. And we want Atlanta to be really the center of the universe for healthcare innovation. If that's true, we are going to have funding from different sources. And I know it's a little bit different than your question, but it's a very important one. And it's always been the problem with sort of the Atlanta region for all sectors, really, frankly, is sort of the lack of venture funds and other types of sources of funding. So hopefully we can build a nidus together where folks who actually have money will look and go, wow, they're doing things in Atlanta. Maybe we'd be putting our money there. And so I encourage that part of entrepreneurship.
Love it. Love it. And what do you guys see as the largest challenges for healthcare as the population lives longer? Question from Christian Ross. Thanks, Christian.
I really want to jump in on that last question. Yeah. Can I say one more thing?
Yeah, please.
I think that's a false dichotomy. I think that the fact that patient benefit and actually, making money in the healthcare system are aligned. I think that it's our mindset and how we sold things to people that makes those two separate things. Yes, it's very theoretically easy to say that I can fix this operational efficiency for you, but you know what? You fix that operational efficiency and that patient ends up back in my ED at a cost to me within like 30 days. That's a problem, right? These are problems that exist that are on the table that actually have to do with kind of the understanding of what are the long-term costs in healthcare and how do you really stack that up in a different way. When you talk to health benefits managers who
You went on mute.
I think we lost you, Monique.
Sorry, guys. I think my phone cut out. But when you think about health benefits managers, who are some of the biggest buyers of some of the healthcare technologies and digital health that's out there today, they're really starting to ask some fundamental questions about value. They're asking questions about, have you just sold me a bag of goods that I've been buying for the last decade? What is this really going to bring to me? And so you're seeing this merger of what is truly patient benefit and what is cost coming together. So I think that sort of dichotomy that, has been put out there as a way to kind of think through what's going to succeed, I don't think that really exists anymore. I think that the landscape is changing. And then in terms of the largest challenges as populations live longer, I think it's really continuing to intentionally design. right? We often design for folks who are young and who use technology in certain ways. Older folks also use technology and adopt it in remarkable ways, but there's slight different nuances in that experience and how you do that, particularly from a technology-enabled care perspective, and then how you surround that with networking with community as well. And so I think fundamentally we have to think through, what does life look like, not just kind of in this lane of folks who tend to be working, building, and designing, but also in the alternative stories that don't exist in that lane.
Awesome. Well, I just want to wrap up here. Thank you so much. Dr. Monique Smith, Dr. David Wright, a lot of great lessons learned here. I want to highlight just real quick, a couple upcoming dates. Go to our healthcare resources page to see these, but we have our next meetup March 29th. It will be in person as well as virtual, but working with a local startup called Reframe around how to build and scale a B2C healthcare company here in Atlanta. So if anybody can attend that, great way in person. They're doing some great things around mental health and building healthier drinking habits. There's a TAG Digital Health Summit coming up end of March, and then another Atlanta Startup Combos in April. And then the last thing, wrap up. I know, Monique, you guys were looking to hire a position. You want to talk for a minute of what you guys are looking for?
Yeah, come work with us. We have a new director of programs role coming on board, and would love to have, great talent who's really thinking about how do we actually make this optimal system for patients, and really kind of has that perspective of operations plus design, as well as kind of product development. So if you have any interest, certainly I'm going to actually post this as a Google Doc link to hear a little bit more about the specific role itself. And at the end of that, you'll also see the link to officially on Emory's career website, which is much more skimmed down. So definitely be in touch. We'd love to hear from you and really kind of think about working better with this ecosystem.
Awesome. Well, thank you again so much for all your time, and thanks everybody for joining. Great session. Lots of lessons learned on starting with the problem and iterating and moving to where the market's going. So really appreciate everybody's time today, and we'll send a recap here in the next couple of days.
Thanks
so much. Have a great day.